Tony. My name is Hannah. I'm going to be your nurse today, okay? Can I get your name and date of birth? Tony Anderson. Okay, confirm that. Confirm that with the MAR. I've provided privacy for my patient. Are you in any pain today at all, Tony? No, you're okay? Okay. I am going to be inserting a catheter for you today, okay? I performed hand hygiene before I came in here, and I gathered all my supplies needed for it. So the first thing I would do is apply hand hygiene, apply gloves, and provide pericare for Tony. Next, I'm going to help him get into the lithotomy position. Okay. All right, Tony, I'm going to help you get into the lithotomy position here. Okay, then I'm going to uncover the area that I will be doing this on. So, first, hand hygiene. Next, I'm going to open my package. Bring the garbage over here a little bit. Pull this out. This can be garbage. This I'm going to set off to the side. And this I'm going to be using as a garbage bag. There. Next, I'm going to open my sterile field right here. So, staying within my 1-inch margin here. Okay. Next, I'm going to set my sterile gloves off to the side. Then, I'm going to grab my drape. And I'm going to lay it down on the shiny side. Okay, so I'm going to come in front of here. Essentially, I'm just going to drop it, and I can fix that once I get my sterile gloves on. Then, we do not need this drape for the purpose of this skill. So that can go in there. And we're supposed to use lube for our patient, but so we don't wreck our mannequins, I'm going to be using some hand sanitizer. Okay, so there's that. Next, I'm going to put on my sterile gloves. Okay, so grab at the cuff, step away, thumbs up, slide my fingers in here, and pull my fingers through, and then I'm going to use my one pull down. Next, I'm going to grab under the cuff, step away, thumbs up, put my hands in here, and my one pull down. Okay, essentially I don't need this anymore, so I can cut that to the side. Then I'm going to fix my drape here, not touching my 1-inch margin. And like I said, for the purpose of this skill, we do not need our lube. So I'm going to come around, drop it in the bag. Next, I'm going to grab my iodine swabs, set those right there, around and out. Then I'm going to, see, I got that done. Going to pull this up here like this. And I do not need my specimen cup for this skill. So I'm going to grab this, staying within my sterile field. I'm going to come out and around. Next, I'm going to grab my sterile water. Take that off, come out and around. I'm going to attach it to the port here. That will blow up the balloon. Okay. Next, I'm going to contaminate my left hand. And I'm going to open the labia just like that. So first, I would take this and go away from me, all the way down to the anus, come out and around. Then I would come on this side towards me and wipe it all the way down, out and around. Then I'm going to wipe it down, all the way down to the anus again, come out and around. Now, what I'm going to do is I'm going to lube up Okay, that should be good. Okay, Tony, I'm gonna ask you to take a deep breath in. When you exhale, I'm going to slide this in for you, okay? Making sure that my hand does not touch the labia or my contaminated hand. And I see urine, so I'm gonna go about another inch in. And then I'm going to slide my hand down, not to touch it. I'm going to grab this and hold it. And I'm going to insert the sterile water to blow up the balloon. Okay. Then I'm going to tug this. Yep, I got a good tug. So I can remove this, and this will go into the sharps container. Essentially now, my sterile portion of my skill is done. So what I'm going to do is I'm going to clean this up right here. And I'm going to remove my gloves, perform hand hygiene, I'm going to reapply new gloves. That are not sterile, they're only clean. And I'm going to hook up the catheter right here around the Y, right like that. And I would attach my bag here to the bed somewhere that would be secure. Attach it right there. Now my bag is secure. Then I'm going to clean up the rest of my sterile field here. And I am essentially going to perform pericares after this. Then I'm going to have my patient get back into a comfortable position. Is that okay, Tony? Yeah? Okay. Cover him back up. Then I would lower the bed and provide him with a call light. And I would clean up my supplies, make sure everything's out of the way, ensure that he has everything that he needs, and perform hand hygiene.